Dr Armstrong, what sort of facilities do you have in Kalgoorlie for dealing with coronavirus?
So to date, there's been no changes communicated with the general practitioners of the town. We are aware of an isolation ward that's been set up, but we have extremely limited resources in Kalgoorlie at the hospital. We don't have a ICU. We have a very small high dependency unit for short stay.
Is this a problem that is likely to be replicated in other parts of regional Australia?
The information I'm getting from my colleagues all over Australia, Queensland, New South Wales and Victoria, is that this is everywhere, that the hospitals are not able to cope with any increased capacity for coronavirus and that they have very limited resources.
So what would happen then, given those limited resources? What if you started seeing multiple cases in Kalgoorlie? What would happen?
Well, we have to transport people out of here. So it's only got 77 RFDS planes around Australia covering the entire regional area. So we would be overwhelmed and people probably wouldn't be able to be transported. And I guess we would probably end up choosing who goes and who doesn't, depending on their risk factors.
What do you think is the risk of coronavirus spreading in Kalgoorlie?
We are at a massive risk. So we've had fly-in, fly-out miners who are exempt from the 14 days quarantine period coming directly from Melbourne and Adelaide, Sydney. So we're a little waiting petri dish for all these people to come. Our community has close proximity living, especially for the mining community, and our Aboriginal communities are not protected.
What sort of social distancing are you noticing? Is the community taking it seriously?
I think maybe since Sunday night, they're a little bit more serious since then. Before that, they were still having parties and going out places, and there was zero consideration for social distancing. There's no social distancing at the local supermarkets or where people are getting their food.
Have health professionals in Kalgoorlie been raising the concerns about the resources that you have available to you with authorities in Perth, with the state government, with the federal government?
Yes, so Andrew Miller from the AMA, we've been talking to him and he's been very vocal in letting people know about our plight. I've spoken to Senator McDonald in Queensland yesterday to tell her what's happening on the ground in the rural communities. And we've also written a number of emails and all the doctors have signed petitions in relation to our ill preparation.
Thanks for giving us an insight into that tonight, Dr Armstrong.
Thank you.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.